Oh, we're rolling. Fantastic. All right, everyone. Last weekend, I guess. Been a while since we did our last diary after being away this week. But I guess I could start with my experiences for the week before, which is in the outpatients department, which was really quite interesting, quite different. Outpatients, inverted commas, is pretty much functioning in the same way as an emergency department. There's no booked appointments, anything like that. People just rock up and bring their health books quite religiously and come with their problems. It's actually really interesting to see the delivery of that healthcare in a way, because we do a lot of the community health worker work and see the patients, and then only if we get difficult ones that they get referred on to be seen by doctors, because not everyone's seen by a doctor. But I guess it's really interesting just to see the delivery of healthcare by other health professionals as well, more than anything, in that how history and examination is taken. I mean, it's all done in an open building with 3 staff and probably about more than half a dozen patients listening into each consultation. If you actually want to do any kind of examination, you have to take them to a separate room. It's, a private room with a curtain and a bed in it. But the local healthcare workers, I saw them do that with about 2 patients in the entire week that I was there, which is very interesting. I probably did a few more than that, maybe because I'm too used to the Australian way of doing things. And language is always an issue, so speaking in Tok Pisin or Pidgin makes things very, very different. And of course, in that open forum, if you like, kind of consultation, you'll often have patients from across the outpatients department who speak better English than the patient, yelling sentences to the patient in Pidgin, what you'd actually ask, so they could try and answer, which is, I guess it's kind of fun in a way, but it's very different. And of course, the concept of privacy is essentially non-existent. In terms of the actual medicine, it's quite interesting that there's a couple of public health campaigns, particularly for children with malaria and people with TB. And so the way they've been marketed, that's probably a poor choice of words, the way they've been advertised is with particular signs and symptoms. So any child that is unwell at all, either with a cough, cold, runny nose or fevers, is brought into outpatients pretty much, you could say instantaneously, because I never saw a child that had been sick for more than, say, 1 day out of probably 20 children, because there's a lot of children in the outpatient. And the second their child is slightly unwell, they bring the child into hospital because they're always concerned about malaria. So I guess it was kind of rewarding in a way to see how the malaria public health campaign had been quite effective in getting parents to bring their children along. But at the same time, it's quite frustrating because out of those 20 children, only 2 of them really had malaria. And the other 18 were not particularly unwell at all and just had mild coughs and colds. Also, in terms of the TB, people have been advised if they have a strong cough that they might have TB and to seek medical attention. The downside of that is the second that anyone gets a cough, they attribute it to be a strong cough because they think that the only thing that can cause it is TB. So I had many people coming in sure they had TB with a 1 to 2 day history of a strong cough, as they called it, which is, of course, TB is more of a chronic cough, is the more typical presentation. So it was quite good to see that those 2 major diseases, the public health campaigns, had made an impact, but at the same time it's a little bit frustrating to be doing the groundwork in that everyone comes in expecting to have one of those 2 conditions, and then all that education you have to provide that that's not necessarily the problem, especially with language barriers, makes it quite difficult. The other thing that I thought was interesting, which is actually quite similar to Western medicine, is the medication expectation. A lot of patients come into the hospital expecting to have some kind of medication for their ailment. I mean, even if they've got a very viral sounding cough or that they're not unwell at all, to discharge them without antibiotics is almost unheard of in terms of the community health workers' approach to delivering care, because it's very empirical. So I guess I tried to do things in as much of a Western way as possible, and hopefully that message got through that not everyone requires antibiotics. But I guess it's quite concerning, the thought of breeding resistance, and when you've got patients with bacterial and serious illnesses, that there might not be medications left over here to treat them. But I guess that's the nature of the beast. So that was the week before last. This last week we went to Kungim, and I won't go into too much detail because everyone's gone before me and had a good chat about what we did in Kungim. But I have to disagree with Ash's sentence about the car ride. I found it most disturbing having 10 people in the car with 2 weeks of supplies and riding sideways without a seatbelt on a gravel road. But then I'm a bit more prone to getting car sick than Ash, evidently. That being said, I had some Coke towards the end of the trip and didn't end up vomiting, which is fantastic. The hike in the mud was very fun, and I guess I won't go through our experiences up there too much because everyone else already has, but one I'd like to add was actually watching the workers install the water tank. So we're going up there on the patrol to install water tanks for their healthcare services up there, both for the workers and for the healthcare services building, so they have access to clean by Papua New Guinean standards water. It's not treated, it's just rainwater off roofs, so, and there's probably a bit of dirt and a bit of stuff in the tank, so whether or not you call it clean by Australian standards, I don't know, but it's cleaner than some of the other water that they have access to. So they were taking off the tanks, and I got to experience some local Papua New Guinean wildlife, which included a scorpion and some kind of tunnelling spider. I'm not quite sure what it was. But I guess what I found most interesting was they told me not to get bitten by it because it hurts a lot, as you can imagine, from a probably 5 to 10 centimetre round spider. And then they proceeded to decide to try and get rid of said spider that was underneath their water tank by poking it with a stick, which I guess isn't too bad a action plan, but the problem was it just ran under the next water tank, and then they just decided that it wouldn't be a further problem. I guess I would call that a lack of forward planning, but they didn't seem to have too much of a problem with it. But then the others came around as well, and they wanted to get a look at the spider, so we managed to coax it out and poke it with a stick a bit more. So that was very enlightening and very cool to see, I guess, because I'd never really seen anything like that, and it was just something a bit different. And I guess, I don't know if anyone else talked about a local Christmas feast that was being planned in Kongim. I'm not sure if they did, but we were on our way home, and we came across a man who was very hard at work building a shelter, which is, someone being hard at work is very odd for Papua New Guinea, so we were quite curious about what was going on. So we asked him, and he said, "Oh, I'm getting a shelter ready for my Christmas feast." Having looked around the village and seen only chickens and probably 2 or 3 pigs, we were curious about what would be for a Christmas feast. And he said, "Oh, a cassowary." And we were wondering how he could manage to catch a cassowary in time for Christmas, because it doesn't seem like an animal that would be in regular supply. And then he informed us that he had a cassowary already. And so, lo and behold, we walked down, and there was a fenced enclosure, if you like, down in the mud and in the trees, and sure enough, sitting in there is his pet, for lack of a better word, cassowary. And he bought it at the market as a chick several years ago, and decided that this year was the year to feed up Cassie the wary on Christmas Day. So it's a shame we're not around for Christmas. Maybe we could have got invited back, but so I saw a real live cassowary sitting in the enclosure. I didn't go into the enclosure because it was eyeing me angrily through the fence, so I decided not to push my luck after avoiding scorpions and spiders the day before. And yeah, I guess that's pretty much all the stories I have to tell. Still having a great time, and be excited to come home soon. It's been a great trip.